Hi, my name is JMichaud, and this is my comprehensive assessment. So first I'll have you get on the scale. So this mark here is about 10 feet. It's a 10-foot Snellen chart.
Okay.
So I'll have you cover one eye with this.
Okay.
Okay.
Just read the lowest line.
So I want you to read this line here, below the red line. All right, so now we'll go to the room. I'm going to give you a moment. You're going to go ahead and take everything off, but you can keep your underwear on and put on the gown, and you can cover yourself with a blanket.
Okay.
Okay?
Okay.
All right. And I'll be back in.
Okay.
Now we wait. So while he's walking in, I'm observing his gait, the way that he conducts himself. Is his movements smooth and coordinated? Is he using any assistive devices? Is his face symmetrical? Is his body symmetrical? Are there any deformities? How is his speech? Is he articulate? Is he making sense? Is it appropriate for the context? Is what he's wearing appropriate for the weather and for the environment that he's in? Is he clean? Is he disheveled? His hygiene. I'm also taking into account just his general skin condition, like do I see any obvious lesions on his face or anything that's showing? So I'm just gonna inspect quickly your hands and see. I'm checking for clubbing or any obvious problems with circulation. I'm seeing how he's breathing. Is he a comfortable position? Is he erect? Is he slumped over? So let's see here. So first I'm going to inspect his head, his face. I'm looking at his face and it's symmetrical if I were to ask him to smile. Both corners of his lips are raised at the same amount. I see that his skin is is of normal color for his ethnicity. Yes. Okay. So let's see here. Just wash my hands. So now I'm gonna palpate and feel his cranium, his hair. I'm checking for the color of his hair, the texture of his hair. I'm checking if he has any nits, lice, or infestations. Feeling the shape of his head. If there's any bumps or nodules, any crepitus, any areas of tenderness. Does any of this hurt?
No.
No. Okay. All right. I'm slightly pressing on his frontal sinuses and his maxillary sinuses if he has any pain when I push there. Do you have any pain when I? No? Okay. I'm checking his mandible and his mandibular joint, temporal mandibular joint, and I'll have you kind of grind your teeth together. Yeah. So I'm checking the symmetry of the muscles, his masseter muscle, and they're equal in strength. All right. And I don't see any obvious lesions, and the skin on his face looks in good condition. All right. So then I'm going to inspect his eyes. We already did the Snellen eye chart test for visual acuity. I'm going to throw on some gloves here. All right, I'll have you remove your glasses for a moment.
Okay.
All right, so when I'm inspecting his eyes, I'm checking his cornea, his sclera, his pupils, I'm checking that his pupils are equal, round, reactive to light. And I can check the light with my ophthalmoscope here. I'll turn the brightness down. So look straight ahead. Yep. And I'll also have you just focus on this here. Look straight ahead, and I'll have you look at this.
Okay.
And then I'll have you look at the wall. And look back at this. And at the wall. Okay, I'm testing for a combination. I see that his conjunctiva are not inflamed, or there's no discharge that I'm seeing. Let's see here. And I'm going to check for the corneal light reflex. So I'll have him look straight ahead again. And when I put a light in his eye, the reflection should be in the same spot in each eye. I'll also do the red reflex. I'm going to dim the lights a little bit here. I'll have you look straight ahead. Yes. Yes, positive in both eyes. And while I'm at it, I'm going to go ahead and look at his ocular fundus. So I'm just going to use this light to shine into your eye. I'm going to be looking at the retina. I'm looking at the configuration of the vessels, of the macula, of the optic disc, the color, the consistency, and if there's any obvious problems. If you want to look straight ahead.
Mm-hmm.
Turn the light back on.
Okay.
All right. Sorry, that's bright. So at this point, I'm going to check your eye movements.
Put my glasses on or off?
You can leave them on.
Okay.
So we're going to check the positions of your gaze.
Okay.
So if you go ahead and focus on my hand, don't turn your head, just track with your eyes here.
Okay.
Okay. And you're checking for a nystagmus. There's some normal nystagmus at the lateral positions, but there should be smooth, even eye movements in all planes. Great. So now I'm going to do what's called a confrontation test. It's checking your peripheral vision.
Mm-hmm.
So. All right. So looking straight at each other, you're going to cover one eye.
Okay.
I'm going to cover the same eye here. All right. So you tell me when you see my hands.
I can see it right now.
Okay, hold on, let me look closer.
I can see it.
Okay.
Yep. Yep. I can see it. Yep. Yep.
All right. So then we're going to switch eyes here.
Okay.
All right. All right. Let me
Right
see my
there.
fingers.
I can see it. Yep. I can see it.
Okay.
Yep.
All right. So now I'm going to check your ears.
Mhm.
So first I'm gonna feel your ears,
Okay.
palpating for any masses or tenderness.
Mhm.
Now I'm just going to inspect for any discharge, the cerumen color. You have assistive devices, I see.
Mhm.
So I do want to check your tympanic membranes. Are you able to take those out?
Yeah.
Yeah.
I can take that out.
Yep. That's fine. Alright, I'm going to boost you up a little bit here.
Okay.
Okay, so I'm going to be checking your canal, the condition of the your canal itself, and then I'm checking your tympanic membrane here, which should be pearly gray. shiny. It has a cone of light in the anterior inferior position. Good. So I'll have you put your assistive devices back in here.
Okay.
And I'm going to check your hearing with your devices.
See how good they really are. Okay, I'm ready.
So I'm going to repeat some numbers and letters and
Okay.
Whisper them. And if you can hear them, you can repeat them back to me, okay?
Okay.
4K2,
4K2,
LS3,
LF3,
11K7,
11K7,
HG2.
HT2.
Good. So now I'm gonna perform what's called the Weber test. So I'm gonna hit this tuning fork and I'm gonna put it right on the top of your head. You're gonna feel vibration,
Okay.
and you tell me if you can hear it in one side or the other more. Okay?
Okay.
Can you hear it in both sides?
Yes.
Yeah. Okay. All right. And I'm gonna try the Rene test,
Okay.
which I'm gonna be placing it right here behind your ear.
Okay.
And you tell me when you can't hear it anymore. Okay.
Okay. Right there.
Can you hear it now?
Mm-hmm.
Tell me when you can't.
Okay. Right there.
All right. So at this time, I'm gonna do a quick set of vitals because I didn't do them when you first came in the room. So I'll be checking his radial pulse and the clock on the wall. Good. So I checked his radial pulse, and I also checked his breathing at the same time for a count of 30 seconds, and I'm doubling those numbers. And then I'll check your blood pressure as well. I gotta do the touch the floor here.
Okay.
Okay, with his feet flat on the floor. 110/70.
Cool.
Great. Right. So now I'm going to get back to the head to toe assessment portion. I'm going to inspect his nose next. I'm going to be feeling just the shape and the contour of his of the cartilage of his nose. I'm checking his nares for any abnormal discharge or and also the condition of his mucosa. I'll use the otoscope actually to check inside his nares here. Sorry, so this might feel a little funny, but I'll have you just relax here. Okay. So I was checking his turbinates, the mucosa on his septum, make sure there's no deviations, no perforations, no lesions, and I'm also checking the patency as well and during that part of the exam. And then next I'll be examining his mouth and his lips. So first I'll inspect, and I'll get a light here. So I'll have you open your mouth. Okay, stick your tongue out. Okay, and I'm just going to manipulate his tongue a little bit so I can see his buccal mucosa. I'm checking underneath his tongue. Yeah, and I'm just checking that if there's any lesions or discolorations on his tongue. And I'll go ahead and I'll have you open your mouth again, and I'll have you say ah. Ah. Yeah, and so when he says ah, I'm checking for cranial nerve 9, it's his uvula should rise midline. And I'll also do one last check here. I'm going to check your gag reflex. This might be a little uncomfortable. You clearly don't have one. Well, that didn't go as planned.
Further in here, I will.
Yeah, okay, well, I'm not about to stick down your throat here. Okay. So I'm also checking his teeth and his gums. If there's any obvious new dental caries, good. And I'll have you stick your tongue out straight. Yep, I'm also checking cranial nerve 12. So just checking to make sure that's intact when we can stick his tongue out straight here. So I'm also going to palpate his lips for any masses or lesions. I'm checking underneath his tongue. I'm going to be checking the soft part of his mouth to feel any masses as well. Is there any soreness here when I do this? Mm-hmm. No? Okay. Good. All right. Okay. Just to overview, when I checked the 6 cardinal positions of gaze, I'm checking cranial nerve 4 and 6. And also his acuity is and 3, 4, and 6 for his ocular movements. I'm checking his acuity, which is 2, and his facial movements with cranial nerve 7. All right. So now we're gonna I'm gonna go ahead and palpate his lymph nodes. So we're feeling the preauricular lymph nodes, and while I'm here, I might as well just go ahead and check to feel the temporal pulse here. Good. I'm gonna raise you up a little bit more here. All right, so I'm also going to be palpating the posterior auricular lymph nodes, his tonsillar lymph nodes here, submandibular lymph nodes, submental lymph nodes here, his occipital, posterior cervical, superficial cervical, and his deep cervical. I'll have to turn this just a little bit. Okay. I'm just checking for tenderness, palpable lymph nodes. They shouldn't be very palpable. If they're large and inflamed, then you consider an issue. Okay. All right. So while I'm inspecting his neck, I'm going to check for his range of motion. I'm also checking just the symmetry in his neck. I'm checking for a tracheal midline, and I'll have you. So I'll have you just go ahead and turn your head to the side like that, and then back to the other side. Yep. And then I'll have you just turn to one side and then to the other. Is there any? I'm checking for smooth movements, coordination. And also, I'll just go ahead and quickly check cranial layer 11. I'll have you shrug your shoulders. Yep, against resistance again. There we go. And it should be equal both sides bilaterally. And then, let's see, I'm also going to palpate his trachea. So I'm not trying to choke you. So I'll have you just quickly take a swallow. Yeah, and you should be able to feel the oh my gosh, thyroid gland. It should be very squishy, and there's no obvious thyroid. You should be able to feel the cartilage of his trachea. All right, so let's see here. While I'm at his neck here, I'm just going to feel his parotid pulse on both sides, one side at a time. Good. All right. So now I'm going to examine the back, your back,
Okay.
your thorax. So what I'll do here is I'm going to have you actually rotate this way. Let me move this thing out of your way.
Okay. Slide around.
You know, I'm just going to rotate this out. Okay, that works better.
Okay.
So yeah, I'll just have you spin a little bit there. Is that okay with you?
Yep, it's comfortable.
All right. Good. So I'm going to have you just lower this down so I can see your back.
Okay.
So first I'm just going to inspect his back. I'm checking the symmetry in his muscles, in his shoulders, and his just the configuration of his thoracic cage. I'm checking for any obvious lesions, discolorations in his skin. And then I'm just going to quickly feel his back for any masses, bumps, tenderness, spots of tenderness. No.
No.
I'll quickly percuss for general tympany here.
Mm-hmm. What is that for?
So I'm checking, essentially, you should hear, there's different sounds that you'll hear depending on what's below what you're tapping over. So in the lungs, there's, it's mostly air, filled with air, so you should hear kind of a hollow
Okay.
tympany sound. There's some areas where you'll hear a dull sound,
Right.
like such as over large organs.
Okay.
And since I also would like to palpate the spinous processes here, just to check for any tenderness, make sure they're even. Let's see here. So I'm also going to do some CVA tenderness, costovertebral angle tenderness. So you tell me if this is painful, and you would know.
Nope. Nope.
Okay, good. So that's essentially checking for any issues or problems with the kidneys.
Okay.
Okay. Now I'm going to go ahead and listen. All right. So I'll just have you take a little bit deeper breaths than normal. So there I'm listening for any adventitious breath sounds, crackles, wails, wheezing. So up high here, we'll be listening for bronchial sounds, which have a shorter inspiration, longer expiration, and then we have bronchial vesicular sounds, which have an even inspiration and expiration. And then out in the periphery, in the bases, we'll hear vesicular sounds, which have a longer inspiration and expiration. All right, so now I'll have you turn back here for a face facing me. Okay. So at this point, I'm going to inspect his anterior chest, thorax, his precordium. I'll be next after this. So first of all, I'm just going to take a quick look.
Okay.
Again, we're inspecting for skin discolorations, masses that we can see. Let's see here. So let me just first, I'm just going to palpate to feel if there's any masses or anything. Good. Let's see. I'm going to listen as well. Take a deep breath. So when I'm looking at his chest, I'm also considering, I would like to do equal expansion. So I should have tested for equal expansion by placing my hands on the back of his thorax, and when he took a deep breath, they should equally rise and fall when he took a deep breath. I think of that now. But at this point, I'm also checking for any obvious pulsations. I'm going to put some tangential lighting down here, so it's a little bright here. So some people you can see pulsations from the heart, so I'm checking for that. I'm gonna palpate. Let's see here for the apical. Should be around the 5th interspace. And then I'm just checking for any other vibrations as well. So I'm going to listen to heart sounds. So I'm just going to feel for the 2nd interspace. The right 2nd interspace. I'll start with the bell here at the base. Okay. And this is actually, I can hear better the aortic valve. And here as well, the 2nd interspace on the left side. You can hear better the pulmonic. Now at the 5th interspace at the sternal border. Here S1 is heard better. And then again, we'll just lateral of the midclavicular line, the 6th interspace. Listening to the apex of the heart, which is also the mitral valve area down here in the 5th interspace on the left. Sternal border is the tricuspid valve area where you can hear that best. So when I'm listening to the heart, I'm listening for gallops, murmurs, any rubs, any extra heart sounds, S3, S4. And then I'm going to, again, listen with the bell to hear any lower pitch sounds. And it's not really indicated on him because he doesn't have a cardiac history, but you can listen also for bruits here, for carotid bruits here, so I'll just go ahead and listen to that. And at this time, I'm just going to take a quick apical rate, count for a minute. So I would count that for a minute. All right. So let's lay you back. I'm gonna check your jugular veins, but first I'm gonna put your feet up. Yeah. And I'm gonna lay you back a little bit here. Okay. Are you comfortable like that?
Mm-hmm.
Okay. So just look straight ahead. I'm trying to relax here. I'm checking for pulsations in your jugular vein here. Get some better lighting here. Lower you down a little bit more. Okay. So at the manubrium here, at the angle of the sternum, I'm going to put a perpendicular line here, and then I'm going to put another perpendicular here at the level at which I see the pulsations, and it should be less than 3 centimeters. So I have 1.5 centimeters, but he's much lower than 45 degrees. So that would mean that his central venous pressure is good, is within safe limit. Yeah. Good. So now I'm just going to quickly check the strength in your upper arms here. So since you're laying down, I want you to just sit yourself up using your upper arms. Good. So we're going to check your movements. First, I'll have you raise your arms up and put them behind your head. Yep, and then behind your back. Yes, good. I'm going to take a quick look at your arms here so I can just see them. Okay, good. So I'm inspecting his arms for symmetry, for musculature, We can just test strength as well. I'll have you pull me towards you and then push away. Yep. I want you to move your hands and back and forth like this. Yep. And then your fingers. Yep. And then spread them. Yep. Good. And I'm just checking to make sure that he has, I'm feeling his joints as well, that I'm noticing that they're smooth and that there's no crevice or any limitations in his movement. While I'm at it, I'm going to quickly check his radial pulse again. I'm going to check them bilaterally to make sure they're equal. I'll grade them at this point too. I'll also check his brachial pulse here. Good. And I'm also going to check his lymph nodes in his arm, his epitrochlear nodes. And they should be non-tender and not very palpable. Good. So while I'm at it, I'm going to quickly check his reflexes. Just relax your hand here.
Good.
Relax your arm here. Check your triceps. Just let your arm relax here. You're relaxing your arm completely.
Mm-hmm.
Yeah, very good. Okay. Just let it relax now. Alright, so just checking his deep tendon reflexes. Alright, good. Let's see here. Alright, so now I'll have you lay back again. I'm going to lay you flat now. So with tangential lighting, I'm going to check his abdomen. I'm checking the contour. I'm checking the symmetry. Is there any obvious masses? And then, so then I'm going to listen to his abdomen here. Starting in the right lower quadrant. And I'd listen longer for vowel sounds. I can also listen for vascular sounds as well. So aortic, renal arteries, iliac, and then femoral here. I'm going to percuss for general tympani. And I'm going to lightly palpate as well. If there's any tenderness, masses that I can feel. I'm also going to quickly measure Okay, and I'm not, so I measured his liver is approximately 10 centimeters. Also checking for splenic dullness as well. Good. All right, so I'm also gonna check, do a quick deep palpation, going approximately 4 to 5 centimeters. I'm checking for any tenderness, guarding, rigidity, and I can also do rebound tenderness. So I'm going to quickly have you take a deep breath in, okay, and then out. So I'm going to be feeling for your liver. There we go, good. And I'm also going to be feeling for your spleen. Good, and I shouldn't be able to feel the spleen when he takes a deep breath in. Good. So at this point, I'm going to quickly. I'm gonna check his femoral pulse here and his femoral lymph nodes. I'll have you. So now I'm gonna check your legs here. I'll have you lift your leg up, and I'll have you run your heel down your shin to the tip of your foot. Yeah, good. And I'll have you do the same for the other foot. Good. So here I'm checking. I'll check for deep tendon reflexes as well. Good. Here's and I'm going to pull your socks up so I can see your feet. Okay. I'm going to have you, oh, you're covered here. I'm going to have you lift your leg. I want to see the strength in your leg. I'll have you lift your leg with your knee bent as high as you can. Yeah. And then have you straighten your leg out and try to lift it up all the way. There we go, good. And then the same with the other leg. And then there we go. Good. All right. So I'm going to quickly check the popliteal pulse here. It should be equal on both sides. Checking posterior tibialis pulse and the dorsalis pedis. It should be equal and present on both sides. All right, I'm going to check to see if you can feel this vibration.
Mm-hmm.
Yeah. Same here.
Yes. Feel that.
All right. So this chair's going to do a bunch of things all at once. So it's going to sit you up. If you want to put your gown back up, you're welcome to.
Okay.
And I'll have you stand when you can.
Okay.
So I'm going to check the strength in your leg. So I'll have you lift one leg and just bend, quick dip. Yep, and the same with the other leg. I'm going to have you walk to the wall and back.
Okay.
I'm just checking his gait, his balance, his movements. Make sure he's not having any involuntary movements. Yeah, good. And then I'll have you look straight at me, right here. I'll have you close your eyes and just stand there with your feet together. Okay. So I'm just checking his balance, his equilibrium. And good. And I'll have you open your eyes. I'll have you, so hold on. Let me just move this. So I also want to check, so I'll have you actually have a seat. Oh, not yet. Actually, I want to check his spine as well. So I'll have you bend over and touch your toes if you can.
Okay.
All right, and I'm just checking the curvature of his spine. I'm checking it's even and straight, perfect. You can sit up. And then while I'm holding your hips here, I'll have you lean to your right and lean to your left, then lean back. Yep, good. And then you can put that back on.
It's really tricky.
Yep.
Okay.
All right. So I'll have you sit down. We'll do just a few more tests here. So I want you to, so I'm checking for some rapid reflexes. This is a test for your neurologic system. I'll have you slap your hands in like that. There we go. And then go a little bit faster. And faster and faster and faster and faster. Good. Good. All right. So the last test here I'm going to do is I'm going to be checking for your pain reflex, or your pain sensation in, if you can differentiate that between dull sensation.
Okay.
So if you just close your eyes, I'm going to be touching random spots in your arms and legs, okay?
Okay.
And you tell me if it's sharp or dull.
Dull. Dull. Dull. A little sharp. Sharp. Dull. Dull.
Okay.
Sharp. Dull. Sharp. Dull. Sharp.
I'm also going to take a cotton wisp. I'll have you close your eyes and you tell me if you feel these when I touch you with it.
Mm-hmm. 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 Yep. Mm-hmm. Mm-hmm. Mm-hmm.
I just touched your foot to your face. It's probably not good. Okay, good. So that, let's see. Good. So that concludes the physical assessment. Do you have any questions at all?
No, I don't.
No? Okay. So yeah, I would review the findings with the patient. I would document. I would explain what just happened to him.